I received a request for a video under the comment section, in the comment section under one of my videos. So I'm going to do a video based on this request. The request was for a video on something called red light therapy. What is red light therapy? It's a controversial therapeutic technique that uses red low-level wavelengths of light to treat skin issues such as wrinkles, scars, wounds, and other conditions. In the early 1990s, red light therapy was used by scientists to help grow plants in space. The scientists found that intense light from red light emitting diodes, or LEDs, help promote the growth and photosynthesis of plant cells. Red light was then studied for its potential application in medicine, more specifically to find out if red light therapy could increase energy in human cells. Now, this would involve stimulating structures in cells called mitochondria. These are cigar-shaped organelles found in the cytoplasm or liquid portion of cells, and mitochondria are the site of energy production as ATP and also fat oxidation as beta oxidation. The researchers hope that red light therapy could be an effective way to treat the muscle atrophy, slow wound healing, and bone density issues caused by weightlessness during space travel. You might have heard of red light therapy by several other names. This includes photobiomodulation, or PBM, low-level light therapy, or LLT, soft laser therapy, cold laser therapy, biostimulation, photonic stimulation, low-power laser therapy. Now, some of these therapies are actually pretty good for muscle recovery. I'm not going to go into that in depth in this video. However, upcoming article in my Applied Metabolics newsletter will tell you exactly how to use light therapy to promote muscle recovery and even muscle growth. But there are many different types of red light therapy. Red light beds found at salons are said to help reduce cosmetic skin issues like stretch marks, wrinkles. Red light therapy is used in a medical office to treat more serious conditions like psoriasis, slow healing wounds, and even the side effects of chemotherapy. Red light is thought to work by, again, producing a biochemical effect in cells that strengthens the mitochondria. The mitochondria, as I said, are the powerhouse of the cells where the cell's energy is created. The energy-carrying molecule found in the cells of the living things is called ATP, or adenosine triphosphate. By increasing the function of mitochondria using red light therapy, a cell can make more ATP. With more energy, cells can function more efficiently, rejuvenate themselves, and repair damage. Red light therapy is different from laser or intense pulse light, or IPL therapies, because it doesn't cause damage to the skin surface. Laser and pulse light therapies work by causing controlled damage to the outer layer of the skin, or the epidermis, which then induces tissue repair. First, then it damages it, and then the body repairs it. Red light therapy bypasses this step by directly stimulating regeneration of the skin. The light emitted by red light therapy penetrates roughly 5 millimeters below the skin's surface. Now, what are the benefits of red light therapy? The benefits may include, when I say may, there's not a lot of solid research on this. I should warn you right now. A lot of this is based on preliminary research, animal research as usual. So taking that into account, this is what red light therapy is said to help. It promotes wound healing and tissue repair. It improves hair growth in people with male pattern baldness. It helps the short-term treatment of carpal tunnel syndrome. Carpal syndrome is an impingement of the nerves in the wrist caused by a thickening of a connective tissue called the carpal tunnel, which impedes on the nerves and prevents the transmission of nerves to one side of the hand. Very common in people who use growth hormone, because growth hormone increases connective tissue synthesis by stimulating collagen production in connective tissue. Unfortunately, in the case of the carpal tunnel, it makes it a little bit too thick, so it starts to press on the nerves. Red light therapy is supposed to stimulate the healing of slow healing wounds like diabetic foot ulcers. It's supposed to reduce lesions associated with psoriasis. It aids with short-term relief of pain and morning stiffness in people with rheumatoid arthritis. It reduces some of the side effects of cancer treatments, like, for example, chemotherapy, that type of thing. It also improves skin complexion and builds collagen to diminish wrinkles. It helps to mend sun damage, again, by stimulating cellular repair. It prevents recurring cold sores from herpes simplex virus infections. And it also improves the health of joints in people with degenerative arthritis of the knee, helps diminish scars, and release pain and inflammation in people with pain in the Achilles tendon. Achilles tendon is the tendon that connects your calf to the ankle area. Now you should know that insurance companies, red light therapy is still considered experimental therapy, so don't expect insurance companies to pay for it. You're going to probably have to pay for out of pocket if you decide to use red light therapy. It's also considered experimental for most conditions, which explains why insurance companies won't pay for it. They don't cover experimental therapy or drugs. Now, the red light therapy is, if you go on the internet, it's said to help a number of other conditions, but there's almost no evidence at all that red light therapy helps these conditions. For example, depression, seasonal affective disorder, postpartum depression. That's a depression that women get right after they give birth to a child. Red light therapy is said to activate the lymphatic system, to detoxify the body. Nope, doesn't really do that. Boosts the immune system, no evidence. Reduces cellulite, no evidence. Aids in weight loss, no evidence. Treats back or neck pain, no evidence. Fights dental infections and periodontitis, no evidence. Doesn't cure acne, and treating cancers, like I say, it can be used in conjunction with some chemotherapy. There is some truth to that. Red light therapy. What about the side effects? Red light therapy is considered safe and painless. However, there has been reports of burns and blistering after using red light therapy units. What happens is a lot of people fall asleep. I mentioned this when I did the video on saunas, that a lot of people can get messed up by falling asleep in a sauna. The same thing with red light therapy. If you fall asleep, you can get burned. You can get burnt, skin burns. Sometimes they get burns from broken wires or corrosion of the red light therapy device. There's also a potential risk of damage to the eyes. Although safer on the eyes than traditional lasers, proper eye protection should always be used while undergoing red light therapy. So that's about it. That's all I could say for red light therapy. Short video because somebody requested this, and not a lot of it. There's not a lot of medical information on red light therapy. It's one of those kind of new age therapies that really hasn't been thoroughly tested. But again, it's pretty popular. It's you find it in gyms, salons, medical offices. Obviously it seems to help some people. So now you have the information if you want to try it. I don't know the cost of red light therapy. I'm sure it varies depending on where you get it. So that's about it for red light therapy. If you want to have the best information available, evidence-based information on nutrition, supplements that work and supplements that don't work, fat loss techniques that work and don't work, anti-aging research, ergogenic aids, hormonal therapy, exercise science, women's health and fitness, and much more, subscribe today to my Applied Metabolics newsletter. 40 to 50 pages every month, no advertisements, written in simple, plain English. Anyone with a 6th grade education will be able to understand. I explain all technical terms. It's not like some of these digital publications that you have to wade through. It's like wading through thick mud because they're written like medical journal articles that are listen, I've been writing science for 45 years. I can't even read those articles. So they're terrible. But it's because these people aren't writers. I've been writing for over 40 years. I know how to write and how to communicate. And you'll see that when you read Applied Metabolics. If you subscribe, I will send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on nutrition, exercise science, what else? Nutrition, exercise science, medical topics, general health. It's all on my in the Facebook page, for a private page only for subscribers. It's not an open page. Also, there's an email portal on my Applied Metabolics site. I only answer questions from current subscribers. I don't answer unsolicited questions. If you're a subscriber, you're welcome to ask me a question, either on something I wrote or something I said in the video. Speaking of the video, you're welcome to leave comments under the video. As I said, this particular video, I did this because it was requested. This topic of red light therapy was requested by somebody, so I did this video. So I do try to accommodate reasonable requests for video topics. And that's what else? That's about it, I guess. So if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. By the way, the people that complain that my videos are too long, they can't complain about this one because I'm stopping it at a 10 and a half minute mark. So take care.